Good morning. Today I wanted to, discuss a topic that I think has been really important to me and driving a lot of my decisions regarding, my path to education and training and how I would potentially like to impart some of, my knowledge and experience that I've gained onto future generations of physicians, surgeons, healthcare workers, or really anyone who is interested enough to hear what I have to say. So this is my talk on the principles of mentorship, kind of how they can apply within medicine, and then just an aside on my experiences. So in the most basic sense and definition, which I know we're all familiar with, a mentor is someone who shares their knowledge and experience to inspire others to reach their goals. What may not be commonly known actually is the etiology of the word mentor, which is actually really interesting. It's born from Homer's The Odyssey, where mentor was actually the name of a teacher who Odysseus entrusted to take care of his son and raise him basically while he was away at war. And in the Odyssey, it was described that mentor was even more trusted than Odysseus' own family to take care of his son. Now, I think if you take that for a little bit more of the literal sense, you may start to imagine a scenario that looks something like this. But when I think you apply it to more understanding principles, this is probably what a lot of us think of when we think of mentorship and what it really means. So a mentor really can kind of wear multiple hats and participate and act in a number of different roles. And this can include hands-on training, didactics, being a motivator, providing advice, sharing in success, providing support and direction during times of need, being a coach, and then helping establish goals. And as I mentioned, mentor can really function in all these capacities, but they don't necessarily have to do it all simultaneously. In fact, as the mentor-mentee relationship evolves, kind of the demands of that relationship can and should change as well. And some of these may be prioritized more than others. Just a little further, just on a couple of those points, in terms of establishing goals, I think initially mentors can function to provide ideas for actual goals, but should evolve to more asking the right questions vis-a-vis like a Socratic method to allow, the mentees to kind of arrive to their own goals and conclusions themselves. As for successes, yes, it's important to laud accomplishments, be proud of, the mentees and stuff, but I think equally as important, if not maybe more important, is the ability to reflect on the process and the outcome. And I'll talk a little bit more about that. And then as for direction and advice, similar to goals, it's okay to help make those decisions early and initially, but, what's more important is providing a framework for mentees to make those decisions and act more independently. Now I'm going to talk about the different types of mentorship. And, this is not necessarily a specific prescription, but I think what's been commonly quoted as the types of mentorship. So there's formal mentorship, informal, peer, and then reverse. Formal is where you have an established formal learning program. There's objectives, set curriculum. So for example, for us, it's, resident rotations. It's our mentorship model, was in our fellowship program. These are all forms of, formal mentorship. Informal develops naturally without any particular structure or program. And I think a good story like this that Dr. Mundis likes to talk to us about is his kind of mentorship relationship with Dr. Albert from HSS, who's also a mentor of ours, and basically just starting that up organically. And, for him, it was developing into academician and getting insight on how to, be fruitful at conferences and stuff like that and get on the podium. So that's kind of an example of informal. Peer mentoring is when you have someone from similar skill level or expertise kind of giving you insights or advice. So for us, it's our like group chat that we have where we're talking about cases. Nikita's sending us his crazy stuff from Mayo, and we're trying to comment on what the heck we would do. But those are all forms of, peer-to-peer mentorship. And then reverse mentorship is, when a mentor is technically less experienced than the mentee, but may have specific knowledge or expertise in the area that the mentee could learn a lot about. Now, when we talk about like phases of mentorship, I think it can be generally broken down into four parts. So you have initiation, foundation, growth, and conclusion. I think an important aspect of this, however, is the more potential cyclical and renewing nature of mentorship rather than, a prescribed longitudinal course where, and by that I specifically mean more of a conclusion may not be meaning or an actual termination point. And I'll talk a little bit more about that. So initiation, this is where you broach, mutual interest to develop a mentorship relationship. Some may be formal in nature, while, others may be more organically, as I kind of described, as the different types of mentoring that's available. I think this is an extremely important step for both parties, as poor commitment from either side, poor communication can really, I think, derail the potential of a mentorship. And what that sometimes means is that you have to be realistic with yourself and what you have to offer and potentially what you have to gain. So I think, like I said, on both sides, it requires a fair bit of introspection and understanding of what you want. Next is building a foundation. And this is where goals and expectations are starting to be set. And, again, as we've seen with the different types of mentorship, again, this may be formal in nature versus not, and versus something that's a little bit more fluid. But I think an important note is that, it's okay to kind of broach between the lines of what different types of mentorship exist. And so, if you're starting out in a more informal mentorship kind of relationship, it's okay to set like concrete goals and establish, things that you want to accomplish in a more formal setting. So I think having that fluidity to go between those spectrum or those areas is important. And then growth obviously is an essential phase in the mentorship, not only for the progress towards the goal, but importantly as well in developing rapport with the mentor, the mentee. And this is important to strengthen that mentorship and I think maximize its potential. Growth can also refer to building the network and perspectives with the mentor, the mentee, and this may be particularly reflected by increasing exposure to personnel or human capital, exchanging of intellectual ideas, and discovering new knowledge bases. And then on a more tangible sense, of course, this is, what helps propel you in achieving your goals and stuff like that. And then finally, like while it's labeled as conclusion, I think this is more of a period to reflect, celebrate, redefine, or reassess. For that latter part, that may be involving setting new goals or potentially changing the mentorship dynamic from formal to informal or informal to peer. In a couple of weeks, we're just going to be finishing up our fellowship, and in a matter of years, we may be, participating more in peer-to-peer mentorship with our attendings here. So it's definitely, I think, important to have evolution and in those types of mentorship. So while acting as a mentor may on the surface seem relatively intuitive, it does take effort and particular skills such as understanding and communicating with individuals, being able to serve as a leader. And Tim gave an awesome talk about this last week. Having some form of expertise or connections to those who may have expertise. And then I think really importantly is just being genuine and realistic. And I'll talk a little bit more in depth about that. Kind of other qualities that you want to have is, a sense of purpose, understanding your strengths and understanding areas for growth. And I think, for the first part of that, you have to have the ability for introspection and reflection. And this seems broad, but it really can apply to a number of different scenarios within a mentorship. And what a good mentor should aim for is reflecting on, I think, purpose, and whether that's the purpose of the particular goal that's been set, purpose of a mentor-mentee relationship, or your own kind of self-purpose. I think you have to have a strong base in that understanding in order to have good standing as a mentor. Understanding strengths and limitations obviously is crucial as well, because it helps prevent you from taking on mentees that maybe you may not be best suited to help. And I think that's sometimes hard to acknowledge, like, especially when someone specifically seeks out your guidance or your help. It's hard to say, like, well, I may not be the best person to help you out, but what can be very valuable is being able to direct them to someone who can assist them. And, I think that is actually even a form of mentorship itself. It's connecting people within your network. Next is creating meaningful connections, being present, showing genuine interest, sharing stories, making decisions, and learning from a mentee and showing that that's the case. I think being genuine is a key component of this. And while it's not a skill you can't really train for, it can be bolstered from reflection, as I've kind of, described before. I think one part of this that I think is also particularly important is, hearing the stories of our mentors and their experiences, particularly when they were at like the same phases of their training or their lives as we are, because, sometimes we see our mentors as really infallible. And I think that can to some degree create a little bit of distance in the mentor-mentee relationship. But I mean, I'm sure you guys are the same when you hear stories about our mentors, making the same stupid mistakes we are making, or, facing the same challenges that we are. It really helps tighten that connection. So I do think that's an important tool to utilize to strengthen mentor-mentee relationship. And then, lastly, understanding unique needs of a mentee, the challenges they may face in participating kind of in an individualized education. Just as we strive to practice individualized medicine, I think so too do we need to understand unique needs of a mentee, and this helps fortify that relationship. It empowers a mentor to best help or guide a mentee. And I think when you look at it a little bit more selfishly, like it improves your ability to connect with individuals from different backgrounds, and you can apply that to a number of different situations. I think, when applying this to our potential futures, and Tim, you've touched on this a little bit before in your talk as well, it's understanding how to be a mentor to different types of individuals in either in our practice or our training setting. We're going to be leaders of our practice, and that's going to include office staff, support staff, ancillary staff with very different skill sets and backgrounds. And so I think a key component of that leadership that you had mentioned is being able to mentor these individuals. And so being able to connect with them and understand, their strengths, limitations, and how to effectively have them participate as part of the team is particularly important. In terms of being a good mentee, I was watching a TED talk about this, and the speaker kind of quoted three different areas that mentees can kind of work on, and it's asking, activating, and maintaining. So asking, broaching basically the initial kind of connection with a mentor. Activating is establishing rapport and finding commonalities, and observing if a mentor is a good fit for you, which is critical. And then maintaining, which is updating the mentor, being respectful of them, and understanding that they're investing their time and taking away from whatever they would like to do to help you out. Along the same lines as being open to feedback and accepting what they may have to offer. So, as important as it is for us to develop good skills to be a mentor, we're still in phases of our career where, we want to work on being a good mentee still as well. And, these traits are kind of can cross over truthfully with being a good mentor as well. So working on these skills is not really for naught. I think the toughest of these, particularly, at least for me, is asking. And it's for the reason that sometimes we're limited by fear of rejection. And, typically we're putting ourselves in a relatively already vulnerable position, and adding this potential for rejection or not getting the response that we may want can be very daunting. And a fix sometimes for that is just, as brutal as this may sound, it's just putting yourself out there. More often than not, we're dealing with individuals who have heavily relied on mentors previously, just as we are, for their success and their status. And so typically that already creates an opening for accepting mentees. Another is to surround yourself in an environment that fosters mentorship. And, this is something that, when I talk with prospective fellows or residents or applicants at different levels, I always say, when you interview there, see who can potentially be a good mentor for you. You can get a sense of that just in the interview process. Sometimes it's a little bit more challenging and does require some nuance, but it is an opportunity to kind of, I think, seek that out and detect that to some degree. And then lastly would be, putting yourself in a setting that's pro mentorship. And again, sometimes that can reduce the anxiety of asking. Now, there are a number of benefits, both on the mentor-mentee side, I think shared benefits as well. From a mentor side, number one, personal growth. You're learning how to become a better leader. You're communicating. You're learning how to connect with individuals from various different backgrounds. So, from a individual perspective, you're going to obtain a lot of personal growth. You're expanding your professional network. And an example I think that we've kind of seen for ourselves is like, hearing about, oh, like the Lanky Fellows, right, percolating all over the country, and now they're kind of establishing their own institutions. Well, now we're going to have like, the Malone, the Boggery, the Stefan, the Mundus, the Eastlack, the Bruffy Fellows all percolating across the country too. And that's, for them, that's expanding their network. That's getting them professional connections that they can either leverage or utilize to help potentially, future mentees. And then finally, like, making a positive impact on an individual's life. Like that's part of the reason why, we got into medicine is to help out people. And so this is just another avenue to seek that out. From the mentee side, like obviously you're receiving support, direction, information, advice, kind of all those things I already talked about. As well as confidence and clarity, and then introduction to those new contacts as I just described. And then I think for like the shared benefits, just seeing new perspectives from either side, either from the mentor or the mentee side. But there can be, challenges with mentorship, and, not everything is smooth sailing and easy. And like, once you get going, and, you have to work at it. But I think some of the things that particularly can derail mentorship relationships are mismatched expectations, meaning that, either the mentee is trying to seek out more from the mentor that can be offered or vice versa. And I think one way to really avoid that is, just being realistic and genuine with yourself and understanding like, what do I actually have available to offer them, and being upfront. It's okay to say like, I'm very busy, but happy to, connect on, a bi-weekly or monthly kind of thing. Versus like, yeah, like, I'm very invested in this. Like, let's spend a lot of time over the course of the next weeks or months or whatever. So again, it's just more understanding what you have to offer. I think scheduling probably goes along with that in terms of managing expectations. Then, being able to communicate. Sometimes we just are afraid to say what we want to, or with fear of, maybe being offensive. But I think when it comes to something like a mentorship, relationship, you really want to lay everything out on the table and just be as vocal and communicative as possible. When we look at applications in medicine, mentorship obviously plays a critical role in training and career development of physicians. And one review article that I read about it, had kind of put it nicely. It's like it's enhancing the implicit knowledge about the hidden curriculum of professionalism, ethics, values, and the art of medicine. I think one really important addition is like the understanding of work-life balance, because you guys can probably chime in on this. A lot of us at this time have kind of broached the topic, probably with our attendings here, about like, how do you achieve this work-life balance? Where have you gotten to your practice where it's kind of, at the level that it is right now? Like, these are things that we're kind of striving to understand because we haven't really had the chance to fully experience it ourselves. We've been primarily in structured settings where our confines are typically predetermined. But now that we'll have some flexibility and control to varying degrees, I guess, it starts to become something that is central to our lives and our careers. And, what we choose to do in our careers will probably emanate particularly from achieving some form of work-life balance. And so that's why I think we're all really hungry to hear about our attendings' experiences and capture those varying levels of perspectives. I thought this was a nice quote too. It's from a review article from the Journal of the AMC, which actually publishes a ton of studies on medical education, quality improvement projects, and mentorship, and the effects of it on training and stuff like that. So what they summarized about mentorship in medicine is that it should ideally be non-hierarchical, has a bidirectional flow, with mentees infusing the relationship with vitality and inquisitiveness, and inspiring mentors to challenge assumptions and shift perspectives. Now, sometimes shifting perspectives can be a little bit more literal in the sense. So I'll give you an example. This is me and Dr. Mundus. We're doing a hemi-lam. We're getting lamina off. We've gotten ligament off. We thought, we did a good job. All of a sudden, you see this. Now, in a very literal sense, shifting perspectives could be this. Dr. Mundus going to the surgeon's side and helping out with fixing our mistakes. But sometimes shifting perspective is understanding, hey, maybe there's a peer who has some, experience into this and can help out. And sometimes that means, Tim coming in and holding us down. So a lot of different, obviously, applications within medicine. when you think about like benefits, particularly within medicine, there have been a number of studies that have looked at, both quantitative and qualitative benefits of mentorship within medicine. And these are examples of studies that have shown documented benefits, including increased research productivity, faster academic promotion, greater faculty retention, and greater career satisfaction. I think when you look at also benefits pertaining to academic medicine specifically in research, there have been studies that have shown that when you assign research mentors or have a formal kind of program, you can increase chances of obtaining grant funding as well as publishing in high impact journals. This was an interesting study that looked at the impact of mentorship programs on medical student burnout. And so in this study, they looked at a total of 135 medical students. They paired 51 of them with resident mentors in a formal kind of setting, and then had 84 of those who were just kind of used as controls. And what they found was that the students with the mentors demonstrated decreased emotional exhaustion, decreased depersonalization, and increased personal accomplishment, as well as having 92% of the residents who participated as mentors enjoying the experience. I think this kind of shows a couple of things. Number one, obviously, like mentorship can, support, can be very supportive and help relieve anxiety and stress. But I think on another level, it's like, you don't always, being mentors is kind of a specific, maybe calling, I would say. You shouldn't be forced to be put in a scenario situation where you like feel like obligated to help somebody out, if that's the case, again, you're not being realistic with yourself, and then, it may not lead to the best outcomes. I think one thing and one aspect that I think should be highlighted is mentorship, at least for us specifically, I would say, is mentorship as it pertains to navigating different biomedical and technology companies. And I think this is something I didn't realize was as important as it was until we kind of got thrown into it, especially this year, just being exposed to all the different companies and the different reps and stuff like that, having more hands-on experience and insights. And this list is not exhaustive by any means, but this is just representative of like the different, companies that we've either used this year or that we potentially might use. And so how to navigate and gain insights, I think, was a terrain that was difficult at first, but, having an experience with the attendings is all extremely invaluable. And, I know at all times during the case, we're always asking the attending, like, why are you using this, like in this manner? When do you use it? Something else kind of thing. And I think another really kind of key component to this is, when we have those meetings with these different companies, and Dr. Eastlack, Dr. Bruffy, Dr. Malone, and Dr. Bagri, whoever is like kind of pressing these companies as to what is the biological or scientific basis for why we're using those things. I think that's a really important lesson in terms of why we're choosing these different companies or why we're using the implants from these different companies. Yes, there's something to be said about using them because we're comfortable from our training, but also it's like, we should be making these decisions for ourselves, and, what is the biologic or, basic science reasoning for why we're doing that too. So I just wanted to very briefly kind of delve into my experiences with mentorship, which I've kind of already touched on before, but I've been super fortunate and super lucky to have been exposed to a number of great mentors, whether clinically focused or research oriented, psychosocial, or a combination of all those. These situations, all for the majority, have been, exceedingly positive. I've gained, lifelong relationships and help with, training and career and stuff like my career and stuff like that. But I think there also has been some encounters where some of those challenges that I brought up, have kind of inhibited, I think, meaningful mentorship relationships. And it's not to, and I don't think you need to adjudicate fault, nor is it appropriate to do so, but it's just understanding that, it's okay to make mistakes and errors in these situations, as long as we're, kind of similar to medicine, as long as you're always committing yourself to continually improving and trying to gain mastery, you're gonna potentially be able to serve as exceptional mentors. This is kind of our mentorship crew that we have here. And I just really wanted to highlight this team here at San Diego Spine. And as I mentioned before, I think one of the main reasons I specifically chose this fellowship was the exposure to the amazing mentorship opportunities here. And y'all did not disappoint. I think we are extremely lucky to have you all, guide us not only during our times while we're here, but I'm sure, for the entirety of career. So sincerely thank you for all that you've done for us. Just kind of to wrap up, with some final thoughts. So, mentorship, I think, will continue to be something that is obviously essential to our careers. And whether that's continuing to be a mentee and gaining insight, I'm sure that will be, part of us for the next several years. But, we're going to be transitioning and take on a more of a mentorship role that we talked about, especially early on while we're leading our practices. So understanding the ins and outs, the nuances, and how to kind of best position ourselves to be successful at either of those roles is really important. Like many things in medicine, it is a skill that can continue to be improved. And as Dr. Mundis always likes to say, aim for mastery, not perfection. Like no one's expecting you to be a perfect, like, oh, this guy is the guy to go to up front, but, work on trying to get to that level and having that reputation. It's a two-way street. So, realize that you may also have something to offer mentors, even though it seemingly seems like you're just absorbing so much stuff from them. Like they are also equally gaining stuff from you as well. There are obviously significant personal but professional benefits to mentorship. And again, I think this is probably like not the most obvious, but I would say I think the most critical is just being genuine and don't force anything. I think if you're just a genuine person who can, communicate, interact, and understand other people, you're going to be already on strong footing to being a good mentor. All right. And that's all I have. Love to take any questions or anything like that. If people have any.
That was really, really good.
Thank you. What's that?
Yusef, what are your plans for when you get to Loma Linda? Let's try to establish that relationship with maybe one of the people that, the senior faculty or something like that. Are you going to try to seek somebody out or just let it happen naturally?
Yeah. I think a little bit of both. Fortunately, I've had an opportunity to meet with some of the reps already, and they've already put me in contact with some of the senior people who are already there, both from a neurosurgical and ortho spine perspective. And I've actually had the opportunity to discuss with some of the other faculty who have previously been at Loma Linda. So I think already from that standpoint, there's kind of been some formal connections. But I think, like you're saying, there's going to be some obvious kind of informal relationship building as well that's going to be happening that I think, probably occurs organically once I'm there and interact with the senior partners and stuff like that. So it's definitely going to be a combination of those two settings.
That's very good, Yusef. Thank you. Yeah.
Thank you.
A lot of good points. I think the most important one was to be genuine. And I think from the mentor's point of view, to be genuinely want the mentee to be better than you. So that's, I think, is the joy for the mentors.
Yeah.
Thank you.
Absolutely. Yeah. Cool.
So that's that study that you talked about med students and residents.
Yeah.
I think it kind of goes back to that point of relationships.
Yeah.
Like how as people and
Right.
through life and
Mm-hmm.
learning,
Yeah.
you need people to create that relationship.
Absolutely. Absolutely. And it's kind of, this whole idea of shared experience as well, right? Like as I was mentioning for bridging the gap in that relationship, it's also useful for overcoming challenges, including, the stresses and anxieties that we may face. So it's powerful on a number of measures.
Yep.
Yeah, I think that's the key.
Mm-hmm.
It's easy when it's easy.
Yeah.
I have hard times where it's super helpful to have that.
Absolutely. Yeah.
There's a less sense of isolation.
Mm-hmm.
You're not the first person to have gone through it.
Right. Well, thanks everyone. Appreciate you listening.